last Tuesday. First of all, as most of you know, the legislation has not been passed yet. It's been through the House, it's been through the Senate, now it has to be reconciled. And so there's still a fair amount that we do not know, but I'll share with you some of the things that, number one, talking a little bit about why I see what has gotten us to this point, and number two, some of the concerns that I see showing up in at least the pieces of legislation that still need to be cobbled together. I'd be the first to say I've been in healthcare for 35 years now, and I'd be the first to say that there are pieces about this system that we have that are broken, that need to be fixed. My concern, of course, is that we don't throw the baby out with the bathwater. When we talked the other night, we talked about whether this is or isn't the best system in the world of healthcare. I think that there are a lot of good things about what we do, but there are other things that need to be improved. When we think about what the cost of healthcare is right now, Tom Bowser at Blue Cross in Kansas City talks about for every policy that he sells, an individual policy, a Blue Cross policy, $1,000 a year goes toward covering the uninsured. The uninsured really has been the rallying cry for much of this legislation, that there are 44 million people in this country who do not have health care insurance. It doesn't mean that they don't get health care, and they may not get it in the most efficient manner, but it doesn't mean that they don't get health care, because as many of you know, if someone needs health care and they show up at my emergency room or any other hospital emergency room, number one, we don't turn them away. Number two, we can't turn them away. There's a federal law called EMTALA, and we cannot turn somebody away just because they can't afford to pay. So we treat those folks. Are there more efficient ways to treat some of the maladies that come through our emergency room than to come to that very expensive emergency room? Absolutely. And there are good things that can be done from a preventative standpoint that are not done because those folks don't have good access to health care. But it would be a misnomer for folks to say that they are not getting needed or emergent health care anyway. We give away, and to that point, as I shared with the other night, our hospital, and it's not a big hospital, our hospital gives away $25 million a year in uncompensated care. Now, we don't have a $25 million bottom line, so we are going out to folks. We charge more to you, to the other insurance companies, in order to pay for those $25 million worth of free care that we give to other folks. My friend Rich Hastings, who runs St. Luke's Health System in Kansas City, describes himself as the tax man. He taxes the rich in order to help pay for those folks that can't afford to pay. So that's the system, a broken system that we deal with right now. Hospitals, we as hospitals, as an industry, early on went to, in dealing with the Congress, said that, you know, if we can get folks covered with insurance, if those folks that come in, the folks that we give away at Liberty Hospital, $25 million worth of care, if we can get them insured through an insurance system and get some payment, and actually get them into places that are preventative care, that are better for folks than to come through the emergency department after they've gotten really sick, then we're willing to give up some of the reimbursement from the Medicare program, from the federal programs. We went to, and cut a deal, if you will, and said that if you can get 96% of the people in this country insured with health insurance, then we are willing to give up $160 billion over the next 10 years in Medicare payment. Now, I believe that the Senate bill that was passed under Harry Reid's leadership, it does not meet that mark of getting folks, the number of folks, the uninsured, covered. I believe that by 2019, under the Senate version, and I'm not as clear about the House version, but the Senate version by 2019 will cover 31 million still leaves another 13 million people uncovered as far as health insurance is concerned. So we have some real concerns about it. The Congress is not fulfilling their deal, if you will, to us as hospitals, and we said we are willing to give up this amount of reimbursement. Some of the things talked about in the healthcare bills can be positive. I think that we can do a better job. We honestly can do a better job of helping to educate people as to how to utilize their healthcare system, and candidly help them understand why not everything needs to be dealt with instantaneously. I shared the other night. There are situations that folks come up into our emergency department. The physician says, you know, if you'll take, and I'm going to make this maybe a little more exaggerated. If you'll take 2 aspirin for the next 7 days, we believe that this will basically resolve on its own. As opposed to some of those folks that come into our emergency department, they want all the bells and whistles of technology instantly. They will come in and say, I demand a CT scan. I want this taken care of now. I don't want to suffer anymore. I don't want to go through the next several days. I don't want to take off several days of work, and I can understand. But again, there can be better ways of caring for those folks rather than instant medicine, drive through like you go through Wendy's and say, I want my health care as quick as what I can get at a hamburger joint. When we talk about the costs, one of the things I guess I believe in education that we need to work with is, as I shared the other night, one of the quotes out there is that 70% of the healthcare costs are spent on 2 things. One, behavioral related issues in healthcare, i.e. obesity and things like that. Folks don't take good care of themselves. And number 2, deciding spend the amount of money that we spend on end-of-life issues. Now, I'm not here to talk about death panels, which have been talked about. I guess what I'm here to say is that we spend an awful lot of money on those last 18 months of life. It's also been projected that 5% of the people use up 50% of the healthcare dollar. Now, so when we come down to saying 16% of the gross of the GDP is spent on healthcare, is that too much or is that not enough? It depends on our, at least to some extent, on our ethical